12-year girl presented with severe jaundice, pedal edema, loss of appetite, mild fever for 1 month, hospitalized for more investigation, diagnosed as cirrhosis liver with irreversible tissue damage, and advised transplantation. She was studying in 7th standard at that time. Then they advised liver transplantation. The patient is not having father. His mother and uncle took the patient to me because they cannot afford this much of treatment at that time. This was some 10-15 years back. At that time they cannot afford because the modern doctors want 20 lakhs rupees for the replacement of this liver. Moreover, one healthy donor is also necessary. They cannot afford because for the donor also we have to give money. That much of income is not there. Then the modern doctors told that 2 weeks lifespan is there. You can take the child home to your house. Only 2 weeks lifespan. Then, due to the presence of jaundice and edema, I diagnosed a case as Kumbhakamala. I diagnosed the case as Kumbhakamala. Kumbhakamala specific lines are given by Acharya how to treat. First again Drakshadi Kashaya, Lekha Panchamola for drinking water, then Puranavadi Kashaya, then after 1 month, the patient was having good appetite. Then I treated just for jaundice with the Drakshadi Kashaya and everything. Then you see, the patient after 1 month, the patient came to me. He is now the edema relieved. The serum bilirubin came to almost normal, not normal by 3 milligram like that. That is not a normal stage. Previously it was 17 milligram. Now it came to after 1 month 3 milligram. Then good appetite is there. Then edema relieved. Then that girl asked me, doctor, can I go to the school? Then I told her, no, you cannot go. At least take medicine for 1 more month. After improving your immunity only, I can allow you to go to school. And after, Pali Suvarnam, Drakshadi Lekhyam, Guluji Kritam. Guluji is the wonderful drug for this Kumbhakamala. Guluji Kritam. That is a specific indication for Guluji Krita in Kumbhakamala. Then Viredana with Tribhuti Lekha once in a week, Parthamana Vipali Prayoga. This is very wonderful medicine for which near 20 days are necessary. Because it is a Rasayana Prayoga, whenever the patient is having good improvement, definitely we have to strengthen the liver. Otherwise, Rasayanena Hyasatyo Vyadhiravi Prayasithiri. It is not told by me, it is told by Delhana in commentary of Susradacharya. So, Rasayanena Hyasatyo Vyadhiravi. Even though the disease is incurable, definitely the Rasayana treatment can be done. Charaka says in another way, Trivandha Maranam Rishtaye, Brahmana istar Kila Malay, Rasayana Tapojapya, Tarpara Irva Nivaride. If Rishtai Rakshanas are seen, Marana is Dhruva. Definitely the Marana will happen. But even after seeing the Rishta Rakshana, if you are administering Rasayana Uchada, Charaka says that Rasayana Tapojapya, Tapa and Japa. What he told about Vishwasahasranama. Tapavajapya, Tarpara Irva Nivaride, definitely that diseases can be cured. Here we preferred, she was admitted in the hospital, Parthamana treatment continued for. That is a specific indication for Guluji Krita in Kumbhakamala. Then Viredana with Tribhuti Lekha once in a week, Parthamana Vipali Prayoga. This is very wonderful medicine for which near 20 days are necessary. Because it is a Rasayana Prayoga, whenever the patient is having good improvement, definitely we have to strengthen the liver. Otherwise, Rasayanena Hyasatyo Vyadhiravi Prayasithiri. It is not told by me, it is told by Delhana in commentary of Susradacharya. So, Rasayanena Hyasatyo Vyadhiravi. Even though the disease is incurable, definitely the Rasayana treatment can be done. Charaka says in another way, Trivandha Maranam Rishtaye, Brahmana istar Kila Malay, Rasayana Tapojapya, Tarpara Irva Nivaride. If Rishtai Rakshanas are seen, Marana is Dhruva. Definitely the Marana will happen. But even after seeing the Rishta Rakshana, if you are administering Rasayana Uchada, Charaka says that Rasayana Tapojapya, tapa and japa. But he told about Vishwasahasranama, tapa japya, talpara irva nivaride. Definitely that diseases can be cured. Here we preferred, she was admitted in the hospital.